Welcome everyone to the Unboxing Careers Podcast. I'm your host, Greg Zachwitz. On today's episode, we explore the career of a psychiatrist specializing in psycho-oncology with Dr. Guy Mittal. Guy, thanks for being here. Welcome to the show.
Thank you, Greg. Pleasure to be here.
This is going to be really fun for me because I have no idea what a psycho-oncologist is. So I'm going to learn probably as much as anyone else listening to this as well. Let's start with here. Let's do some level setting. Quickly tell us exactly what a psycho-oncologist does and how long you've been in the field for.
So a psycho-oncologist is someone who works with people and families dealing with cancer in one way, shape, or form, and specifically deals with the psychological, emotional, and relational issues. So the challenges that people have in terms of their experience, their feeling, their sense of themselves as they go through cancer treatment and beyond. And for some people, it's even before, because there are people with certain genetic predispositions to cancer that have to make certain decisions about their medical care, even though they don't have cancer. So psycho-oncologists work in the psychological, emotional sphere of that.
Very good. How long have you been practicing for?
Over 20 years.
So I've
actually exactly 20 years since I finished my training. Exactly 20.
There you go. 20 years today?
Not today, but in a few months.
There you go. All right. So I got to go back a little bit then.
Yeah.
Walk us through. I normally ask, like, how'd you decide on this as a career? But I want to I'm going to go back to that, but I'm going to skip this a little bit. This is I don't know if it's a specific niche, but it is a niche of care. So how did you find your way into this particular area?
It's, so I'm going to take a step back and let you know that psycho-oncology is a unique field or subfield because people come to it from many different disciplines. So you can be someone who is a licensed clinical social worker and do psycho-oncology work. You can be a psychologist and do psycho-oncology work. You can be a chaplain and do this work, or you can be a psychiatrist. So I was in my psychiatry training, and I'm happy to get into what that entails. But that means basically that I went to medical school and was doing residency training in psychiatry. But I was always interested in the big picture questions of what it is to be human. And how do we make sense, make meaning of our presence here, given the fact that each of us has an expiration date. And people who are going through cancer, now, cancer is a good news story. I know many folks associate the word cancer with suffering, even death. But 70% of people diagnosed with cancer today in the US are alive in 5 years. At the same time, when you get diagnosed with cancer, you're thinking about the meaning of your life on some level. And I was always interested in that, and I learned about it through a mentor of mine when I was in residency, because I was interested in end-of-life concerns and helping people at the end of life. And he said, have you heard about this little subfield called psycho-oncology? And I said, nope, and started learning about it. So that's how I meandered my way into it over time.
Interesting. And I'm assuming I'm going to jump all around today's interview, so I apologize to whoever's listening.
Yeah.
There's no flow whatsoever. So when you said you were in residency when you kind of figured this out, how did your career progression look at that point? Did you intently focus on this, or did you kind of cover, like the instance you gave before, hey, you could do this and dabble in that? So what was your kind of progression into doing this like a full-time scale?
You mean after residency?
Yeah, so were you seeing patients for things other than oncology related, and then you shifted over? Yeah.
So psychiatry residency is a general training in becoming a psychiatrist. So you see people with the whole range of psychiatric issues and disorders in lots of different settings, in a clinic, in a hospital, in an emergency room. My area of interest focus was at the intersection of general medicine and psychiatry. So people who have other illnesses, other medical illnesses, and deal with psychiatric illness or have psychological reactions to that. So always at that intersection. And I focused on that towards the end of my residency. And then I did training after residency, which is called a fellowship. So I've done a lot of training over the years, specifically at a cancer center in the Boston area called the Dana-Farber Cancer Institute. And I did a year training doing nothing but psycho-oncology work. And then I got the stamp of, you're now trained, go out, go forth and do your thing. And then I'm happy to talk about my career over the years, but that's how I completed moving from being generally trained to being very, very focused on this particular area and walking out with that year of training.
Very good. So I'm going to get into that in just a second. I'm going to now skip all the way back because I'm a terrible interviewer here. Deciding on psychiatry as a career, when did you kind of get into, hey, this is what I think I want to do?
When I got to medical school, I was pretty clear I was going to be a psychiatrist because I wound up in medical school, and you're getting a sense I like more than just biology. I just like the whole experience of being human, and that's like the arts, poetry, and literature, and music, and history, and philosophy, and science, and all that stuff. And for me, having a career focused around a single organ or organ system wasn't that interesting. So to be someone who studies or takes care of people with kidney disease, for example, very important work, just wasn't for me. I was interested in the biggest possible picture of a human being, and that was psychiatry. And along the way, I also discovered, oh my goodness, internal medicine is really cool. Not because of the physiology, which is kind of interesting. People find different parts of medical school fascinating. But because it is when people are at their most human, vulnerable, connected, and someone who talks like this is probably going into psychiatry. Very different from, my goodness, I loved reading EKGs, or I couldn't wait to go into the operating room with the surgeons. That's cool. We need those people for sure. But I would really enjoy the connection with people, but also that I could help them feel better, both physically and psychologically. So by the time it was over, medical school was over, I was clear that I needed to do a little bit of internal medicine and then a lot of psychiatry. So that's what I did.
Okay. All right. So your goal going into medical school wasn't necessarily psychiatry. Did you have a focus, or was it, hey, I know I want to be a giver of some sort, and that yes. I'm going to use school to kind of figure that out?
Yeah. I mean,
okay.
You mean before medical school? Are we rewinding? Or you mean when I got to medical school?
Well, when you got to medical school, like when you were applying for medical school, you knew you wanted to be a doctor of some sort. You just didn't know which focus you wanted to.
I wasn't sure. I mean, I had an inkling I would be a psychiatrist, but I wasn't sure. I wanted to contribute in some way. Like for a while, I thought I wanted to be an obstetrician. Delivering babies, that's really amazing to watch and help and support. I thought this would be really great. But then I decided not to. So
there you go.
Yeah.
All right. So walk us through, if you can, kind of starting out. So you get the specialty, you kind of go through your residency, you become certified. Now you hit the real world. If someone wants to be a psycho-oncologist, like what does those early years kind of look like for them? What is the typical progression for those people?
Yeah. So I'll give you a bigger picture, a bigger scope than just if you're going to be a doctor. In fact, if you want to do psycho-oncology full time, it's probably better to not be a psychiatrist.
Okay.
Because the only way to do it full time really is to work in a cancer center. That's the reality of the field at this point. So if you're in a cancer center, guess what? All of the patients you see are dealing with cancer. That's pretty clear. If you're not in a cancer center, then psychiatrists, this is a real world reality. Psychiatrist time is very expensive, so it tends to be deployed to a variety of things where that expensive resource is needed. So there's often this exchange when you're starting off as a young psychiatrist, that you get to do a little bit of what you like and a lot of what the system needs you to do, which might be more general work. And over time, the intention is to do more of what you like and less of the general work till one outweighs the other. So that's actually what I did. I did a lot of work with general psychiatric care. I did a lot of work with medically ill people who aren't dealing with cancer. And I was the first psychiatrist at my hospital. I was in Boston for many years at a place called Mass General Hospital. I was the first psychiatrist who worked on the palliative care team. That's the team of doctors, nurses, other folks who support folks dealing with life-limiting illnesses. So I had the profound honor of being the first person to ever do something like that, and did that for over a decade. I want to come back to one thing that I said. I said it's easier. Please. I said if you want to do this work like full-time right away, the vast majority of people who do this work are either social workers or psychologists, because so much of the work is supportive psychotherapy, counseling, things of that sort. And those career paths, those fields are more specialized in doing that type of engagement with patients.
So you mentioned you would recommend not going into like a cancer hospital right away because that's what you're dealing with. What is the reason for that? Is it because it's too heavy for them right away and you don't have the kind of the well-rounded experience, or is there a different reason?
No, I want to correct myself. If I said that you shouldn't go right away, that's not what I meant. What I meant is the only way to do it full time is to get a job at a cancer hospital.
Oh, I got you. Okay. I might have misunderstood you. Yeah.
That's all. Oh, well, we got there. The challenge is those jobs are relatively rare. There aren't that many of them. So that's one. The other is it might be too intense. Doing this work all day, every day is very intense and can be quite challenging emotionally. So having part of your day be not that, doing something that is a little less intense, a little more general, where you're not thinking about severe medical illness or the end of life or the profound social challenges that people deal with in cancer, which is a whole other conversation. It's nice to have something you can just do and isn't as, heavy. So a lot of people do that. It's also helpful to have under your belt some more general work, because again, very practically speaking, it makes you more employable. If you can say, I can do cancer, but I can also do these other three things.
Makes sense. I want to go back to the emotional toll real quick. So are there techniques that maybe you've developed over time? Every therapist or any doctor who kind of deals with kind of those heavier life issues talk about the difficulty of kind of leaving that at the office, right? It's hard to just go home and disconnect. You're not just clocking out. Are there skills or techniques that you might recommend someone either that you've learned or recommend someone kind of start honing or doing now to kind of prepare themselves if they plan on working with something a little more, heavy?
Yeah, quite a bit. The first step is to recognize that you are vulnerable to that. We've all had teachers who we knew in grade school and junior high school and beyond. We knew they didn't want to be a teacher anymore, but they were just kind of sticking around for whatever reason. People stick around in jobs they don't like. nobody becomes a teacher in order to be burnt out and bitter. Yeah. Nobody becomes a doctor or a psychotherapist in order to become burnt out and bitter. And yet people become that. And every one of them started off as a deeply idealistic, caring human being who couldn't wait to help people. You know, there's a saying I once heard, you can't burn out unless you've been on fire. And people coming into this work are ablaze with the desire to really help. And it's important to realize if that's you, that's amazing, but you got to nourish that. Yeah. Rather than they'll get to it, it's not me. So that's the first thing. Just to know that, my goodness, I got to protect this. And this is my heart, my love for people. I try to keep in mind when I meet a patient that I may see a lot of other patients, but to this human being, I'm their only doctor. And that's a tough thing to keep in mind because, one after the other, after the other, after the other, after the other. And so what do? I have my own therapy. I make sure that I stay fit, actually, eat, get sleep, exercise, make sure that there's time in the day for people, hobbies, whatever it is. And I've done a lot of outside personal growth and development training through several educational organizations, the most prominent of which is called Landmark Worldwide. That's made a huge difference for me to really get the following, that I'm here for you. And if I'm focused on my feelings in the moment, then I'm not with you.
Yeah.
And which isn't to say I don't have feelings and I'm not left sad or moved, or certainly I've cried with patients and certainly I've kept a distance when appropriate, but constantly tending to that is really important.
Yeah, that's really well said. Can you walk us through, Guy, what a typical day or week looks like for you? And I know this is going to vary based on what you're doing, but just kind of give us a sense of what your week looks like.
Well, I'll give you two answers to that. So in the last few years, I've made a change in my career towards more leadership roles. And so I'll tell you what it looks like when I was doing more clinical work. I still do some, but it's much smaller amount. A day in the week is pretty straightforward because I show up. Now, actually, since COVID, there has been a revolution in mental health care in the United States. And I mean like this incredible transformation that nobody saw happening this quickly and this universally until COVID, which is the move from in-person care to video conversations. So it's like we're having this conversation now. There are several settings where you can be doing psycho-oncology work. One of them is in an outpatient clinic where people show up physically or log on and you engage in conversations like that. Others, maybe you're doing work in the cancer center physically where the patients are getting their chemotherapy. Some social workers work in that setting, for example. Sometimes people work on the actual inpatient hospital floors, not just the treatment rooms. So for me, I spent most of my career doing outpatient work like this and doing hospital-based psychiatry where I would visit people who have cancer who also have some sort of psychosocial need. So a typical day would be starting my day with organizing myself, looking at my patient list for the day, figuring out when I'm going to find time for lunch, making sure that it's set aside, noticing are there any meetings or other obligations, and then executing. My day were always some combination of seeing patients, teaching, mentorship, and doing all the administrative work that's involved in being a clinician, paperwork, letters, writing your notes, things like that. But one of the great advantages, gifts of working in what's called an academic hospital, where there are medical students and residents, is there are a lot of opportunities to teach and learn a lot. So that would be it. Occasionally, I'd spend a morning or an afternoon in the hospital itself seeing patients, maybe once a week. So it's not that complicated. That's kind of the day of a clinical person. And then over time, I transitioned to more leadership roles. So now I help run a company. And that involves a lot more thinking, meeting, talking, writing, reading, as well as being a boss, mentoring people, managing projects, and also seeing patients.
I was going to ask about career advancement, and it sounds like you have multiple opportunities to kind of progress based on how you want to do it. Can I ask personally why you made this transition from what you were doing, and you obviously have a passion for, to working for a company and taking on that leadership role?
Sure. I glossed over, it's hard to get into a 20-year career, but I glossed over the fact that throughout my career, I've had leadership roles. It's something that's always been something I gravitated towards. And here's what it boils down to is I like it when things work well for everybody, and I don't like complaining. If you like that things work around you and you like complaining, then you'll not advance very far. And listen, people can take complaining to a high art, no problem. But at some point, when you get tired of complaining and want to actually improve things, then you're going to go and reach for the opportunity. And if you're lucky and persistent, they'll say, sure, let's see what you can do. And over time, I became clear to me that there are things I want to contribute, that if I'm only seeing patients, I can see in total, like have my clinic have several hundred patients if that's all I'm doing. Through the company that I work or previous leadership positions, I got to impact thousands and thousands of people, and that was really exciting for me to do. There's a loss of this intimate connection that you can experience a lot. So I still retain it a little bit, and then my job is to kind of clear the path for all of the clinicians to do theirs so that they can focus on providing this care and doing it well.
Good. That's great. Thanks for sharing that. I appreciate it.
Sure.
How about work-life balance? It sounds like it's fairly decent overall in the grand scheme of things, because I'm assuming based on the role, you might be able to set your schedule. If you're working for an organization, maybe not. But how is the work-life balance fairly decent in this field?
Yeah, it's pretty decent. You know, one of the things, one of the jokes I like to say is you probably shouldn't get advice from a cardiologist who smokes. You probably shouldn't get care from a psychiatrist who doesn't know how to like take care of their own well-being emotionally. So for me, it's actually a professional obligation. It's not like, oh, isn't it nice to have? It's a professional obligation to be able to engage in this kind of, okay, this is when I do this, and this is when I take care of personal things. But I'll be honest with you, I don't like I know it's important, and it's a phrase that we use. I don't like the phrase work-life balance because it puts things in opposition to each other. Like there's work and then there's life. I mean, work and leisure. And then they kind of, if you do more of one, you do less of the other. For me, it's more what I've learned over the years is, what do I want to do with my time? And then go do that and figure out how to make it happen. That could be spending time with loved ones. That could be spending time at work. One week, maybe I'm spending 60 hours, 70 hours at work, and one week, maybe it's 30. So one week, there are many family obligations, and one week, everybody's away on vacation, and I'm the only one around. So is that imbalanced, or is that, no, this is what matters, let's make it happen?
There you go. It's a nice way to reframe that
Yeah.
perspective. So,
Yeah.
how about? I was going to ask you about competition in the field, and this probably has two different answers to it because you mentioned very early on that hey, if you only want to do this, there's only so many. There's only so many positions, right? It's not
Yes.
a robust position. Can you talk at least in a high level about the competition in the field? Like if someone's coming out of college with this,
Yeah.
should they expect to be gainfully employed?
Yes. Uh, as I mentioned, the different professions that can do this work. So if you're coming out of college, you're probably going for another degree, either a master's degree. But when you're coming out of training, there is a shortage of people who can do this work. Not psychiatrists per se, but clinical social workers, psychologists, other people who do psychotherapy. There is a pretty high and growing demand because in the US, there is amongst cancer centers and cancer organizations, there's a growing openness and understanding that taking care of your psychological and emotional welfare as you're going through illness treatment for your illness and beyond, that's critical for you doing well. So there's like not much competition. I mean, there's some always, but you will be gainfully employed if you come out and this is what you want to do. The other thing I would add is your part. There's a national professional organization that is one of true camaraderie. So people from all over the U.S. who do this work participate in the professional organization. Has a long name, the American Psycho-Social Oncology Society. But and that's another way you can get support in a job search, in mentorship, in building a career over time.
That's great. Correct me. I'm going to assume something here, but correct me if I'm wrong. I'm assuming this is probably more applicable to like private practice.
Sure.
But can someone go into this field and say, "Hey, I only want to work with people who I want to specialize in treating patients or families of certain types of illnesses, so breast cancer, certain types of cancer."
Sure.
I'm assuming the answer is yes, but is that, I don't say common, but is it a realistic expectation if someone says, "Hey, breast cancer touched me deeply as a kid, or my family, this is who I want to work with"? Is that realistic?
It is. It might take a little bit of luck and finesse to get there, but there are certainly people who do this. The easiest way to be that specialized actually is not through private practice, although people can do it that way. Because in private practice, the lingo is you eat what you treat, meaning if you don't work, you don't get paid. So it's hard to be that picky. At least at the beginning, where you need to build up a practice. But if you want to really be specialized, where that happens is in large cancer centers, because they need a psycho-oncologist for the breast cancer clinic, or for the leukemia and lymphoma clinic, or for the colon cancer clinic. So absolutely. And the more prevalent, there are two things that really determine how many jobs are for a particular subspecialty within the subspecialty, which is how common is the illness and how many people survive the illness. And breast cancer tends to be very common and has a very high survival rate. So that's one of those, you just happen to touch on it, one of the illnesses where there is a very large need for psycho-oncologists.
Okay. As we start to wind down here, Guy, talk to me if you can. This is a pretty broad question, but someone who's in high school maybe now looking at going into this field or a related field, essential skills or kind of personalities or temperaments that would either make you better suited, worse suited for the career, or that, hey, I'm okay at this, but this is something I can hone over the next, X amount of years.
You have to enjoy getting into people's lives. You have to be, I think, someone who is curious and patient and open to learning. Those are critical. And someone who's willing to develop and train themselves in talking to people about really challenging subjects, things that most people don't talk about on a day-to-day basis. Now, in high school, you're probably not doing that. No problem, but you have to be open to doing that. The other thing I'll say is, funny enough, read a lot. And I don't mean read a lot of nonfiction, which is great. I mean read a lot of fiction, because that will teach you about other lives that you might never encounter in other times, in other locations, in other parts of the galaxy, whatever you like. But the more you read stories and novels, the more you will learn just how diverse the human experience is and just how universal certain things are about it.
That's a really cool piece of advice. Very unique, too. No one ever says that, so that's really good. You might have answered this already. Feel free to kind of gloss over if you did. But if you look at kind of your careers, not specifically you, but like the career as a whole, what do you find to be the most challenging part of it?
I haven't answered it. I think the most challenging part of it is that even though what I said about the world of cancer care being more aware of and open to this, it's still seen as a low priority. So it's always, that for me is the biggest challenge, is that it's seen as like a nice add-on, where from inside the field of psycho-oncology, it's essential. But it really is essential, in my view. And as I say to patients sometimes, just because you're biased doesn't mean you're wrong. But I think that the world of cancer overall will say, of course, this is important. But if you look at where resources are allocated, meaning where they spend money, it's not here. And that is something that the field of psycho-oncology is actively advocating for as we speak. But it can be quite challenging because, that's just the therapist, that's just the mental health thing, don't worry about it, we're going to fix your illness, like that.
Yeah, that's it's got to be tough, right? Especially it has to be challenging, I would think, when you first talk to a patient in whatever setting. It's got to be challenging for them to kind of, right, they're coming to grasp or coming to terms with everything, right? They have this life-changing event. Like you mentioned before, they're scared, they're starting to question things. Like overcoming that seems like it would be a really hard thing. And I would think that the psychologist would be kind of last down the line, right? Give me the medicine I need. When are my appointments coming up? So yeah, that's really good insight. I'm going to ask you the flip side to that. What's the most rewarding part of the career?
Oh my goodness. I have to pick just one.
Throw a couple out.
Well, I'll tell you, there are, like, I can, just in being with you, I can think of half a dozen patients that I've met over the years that have touched me profoundly by their resilience and courage and vulnerability. And my goodness, I want to be them when I grow up. So having encounters like that is so special. Like, who gets to talk to people, strangers like that? And the privilege of that is just such an honor and such a delight. I'm literally just thinking of someone I worked this weekend, and I saw them in the hospital, and I just thought, my goodness, just so moved by this person's courage. That's really one of the biggest sources of fulfillment. The other is in teaching and training the next generation of people who do this work, because part of it is the content of what do you do when someone says, or what do you do when they present with these symptoms. But part of it is, who are you going to be when you walk into the room, so that you could be an effective clinician. So yeah, those are the two big things that are really, really rewarding.
So, Guy, there's no way we covered everything here. And I know I forgot to ask you something important, I'm sure. Is there anything that maybe I did neglect to ask you that you feel would be important for the audience to know?
No, I actually think you hit all the high notes. Actually, you know what? There is one other thing. Thanks for the offer.
I said I never get off easy.
No, it's like the one of the challenging parts of the field. So everyone thinks, oh yeah, everyone assumes that what patients or their loved ones want to talk about is like death and dying and meaning and all that stuff. That's actually pretty rare. Most people don't want to talk about that. I mean, do you? I'm not talking to only to you, Greg, but like, do you want it to anybody? Do you really want to spend your day?
I do not want to talk about it.
Exactly. People want to talk about the things that matter to them, like their family, like their career, like their hobbies, like their grandchildren. That's what you're going to spend a lot of time talking about. So I think sometimes when folks think about psycho-oncology, go, oh, I can't talk about death and blah, 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 all day long. That's actually pretty rare. Because again, nobody wants to talk about it. And that's fine. Occasionally they do. The other thing, so that's part of what has it be fulfilling and rewarding, is you talk to people about what actually matters to them rather than beating around the bush. The other side of it is people deal with, I mentioned in passing very briefly, there are a lot of social challenges that people have when they go through cancer. One of the biggest ones is financial. People really struggle financially, even people with insurance. And the worries about stuff that leaves me feeling helpless, that also shows up. How can I pay for transportation to my chemotherapy and for a babysitter? I can't do both. And so working with people in that is way harder in some ways than let's talk about the end of life. Because that's real. That's present moment real.
So if I could follow up, I want to follow up on both fronts, but the first thing you said with, hey, people want to talk about the fun things in their lives, right? The family, the things that are important to them.
Yeah.
Does that, in some respects, I imagine that is, helps them kind of not heal, but like helps them navigate the process much easier, kind of flesh them that out. Is it make it more challenging for you as a professional, knowing that, hey, at some point we need to talk about kind of the realities here to help you have those coping mechanisms and frame things the right way? If they don't want to talk about it, is that challenging, or does it kind of work itself out naturally?
You know, I used to think so when I was first starting out. Like, when are we going to get to the real stuff? Like that kind of deal. And then I learned as I went through that people really are doing their best. And for a lot of folks, conversations will end mid-sentence. Life doesn't get tied up in a neat bow. And people will talk about what they talk about. And that's them coping. If I try to make someone talk about something they don't want to or aren't ready to, I will make it worse for them. In other words, if someone's got a coping mechanism, don't take it away unless you've got something better. And I almost never have anything better. So we'll talk about what you want to talk about because that's how they're coping. And at some point, you're right. If people really are avoiding like big decisions, then we have to find a way. But that's not an everyday thing.
Yeah.
Mostly it's, I'm dealing with depression and I'm not getting along with my husband and I don't know how to navigate the world of applying for disability at my job. So things like that, which is heavy enough.
And then I want to flip to the other side too.
Yeah.
Last question before we get you out of here. But when someone you gave a good example of like the cost of treatment, right, which can be astronomical. If someone's coming and dealing with those things with you, I've got to imagine that's just as difficult to kind of navigate because there's no way to be like, here's a solution. The money is the money, right? You either have it or you don't, and you go into debt or you don't. Does that make it, when people have financial issues, does that make it especially challenging for you to help them? Because we've all been in debt at some point in our lives, whether it's through medical school bills, student loans, or, whatever reasons. Like it consumes your mind, or it can consume your mind. And then you've got that on top of this other main thing. I've got to find it really hard from your perspective to be able to deal with that. Is there anything that people should kind of prepare for when it comes to that? Or is that just kind of a relationship type feel to get through?
Well, it can be both. I mean, there are things you can prepare. The thing to remind folks is where I come from is people are pretty darn resilient. They really are. And there are helpers. So on the one hand, I can't say, well, this isn't my job. Let's talk about something else. Because, you're going to go talk to the financial aid office in the hospital. They'll take care of that. On the other hand, like you said, I don't have money to give them. But what we do talk about is exactly what you were pointing to, which is how do you cope with the anxiety on top of anxiety? How do I sleep at night worrying about the money? Because it is really happening, just like the cancer is really happening. And that's the work, rather than fixing it or pretending it's not happening.
Yeah. Very good. So we kind of ended on a downer here, but we'll try to pick it up here. So, one, I enjoyed the conversation a lot. It was really insightful for me. So I appreciate your time. If someone wants to reach out to you, we'll link all this in the show notes. But if someone wants to reach out, either ask a question, check out your company you're with now, whatever. What are some of the best ways for them to get a hold of you?
The best way is through my email address. It's first initial last name at forgehealth.com. So gmail@forgehealth.com.
Perfect. We'll throw it on the website show notes, so be sure to check that out. I hope you enjoyed the episode, everyone. Explore other careers or share your career with us. Please check out our website. And until next time, go Bills. And finally, go Sabres.